Good evening, everyone. I'm Reverend L.K. Floyd, the president of the Coalition of Churches and Community USA, and we are thankful for another day as we continue to advocate for equality, economics, and education. My brothers and sisters, we have with us a great panel today to share with us on the subject of mental health as we deal with mental health awareness. As we know, the coalition is continuing to fight for equality, economics, and education. And this is one of our educational points today: mental health awareness. As well as today, we're going to talk about the impact on mental health in the African American community. And so today we have with us two very special guests, Miss Candace Willett. She is a health coach and also evangelist Trinita Lattimore, Mrs. Trinita Lattimore, who also works in the medical field. And we have also another guest that will be joining us in a few. But most certainly, we are thankful to have these participants with us as we talk about mental health in the African American community. And so we want to start with Miss
Uh-oh, he's freezing.
we're going to start with Mrs. Willett. Miss Willett.
Hello, everybody. Thank you, Pastor, for that introduction. Just a little bit about myself. I am a certified health coach. I'm also a health educator, and I'm also a health manager for the federal government, where we do a lot of health, mental health, psychological safety for staff. My background is in community health as well as population health and around focused on health psychology. So that's what I do. And I hope I can give you guys some resources and some education around mental health since it is Mental Health Awareness Month, the month of May. So I'm glad to be here.
Well, we're most certainly glad to have you here and your expert with this, the Coalition of Churches and Community USA. All right, thank you. Next, we're going to ask if Ms. Trinita Lattimore will share with us her experience.
All right. Hi, everyone. Thank you for that introduction as well. I am a
Share with us
licensed.
a little bit about her.
Oh,
Continue.
okay. I am a licensed clinical professional counselor, supervisor, licensed in the state of Maryland as a mental health therapist, as well as a licensed professional counselor in the Washington District of Columbia. I'm a clinical supervisor at a methadone clinic here in the Washington, D.C. area, our Anacostia part of the city where it's predominantly African American people that are addicted to our to drugs and alcohol. So I work in that facility, and every day I see what the effects of drug and alcohol does to the African American community. I'm also an evangelist and pursuing a doctoral degree, Doctor of Ministry in the fall from Lancaster Seminary and Christian College in Lancaster, Pennsylvania, as well as by way of Greenbelt, Maryland.
Thank you. We're elated to having you a part of this panel and sharing with us your expertise. Also, we have Miss Sherry Cook. She's a not just a advocate, but she's a motivator. And so we want to hear a little bit about yourself.
All right. Hello, everyone. How are you? I'm just actually logging off of my show. And yeah, I'm jumping right into another meeting. So I am Sherry Cook. I am, goodness, I'm all talked out, y'all. I am the chief creative visionary behind Keeping Each Other Motivated, which is Keon Works. And I am a motivator. I don't specialize in mental health, but I'm all about changing negative mindsets and encouraging people to think past what the right now and thinking outside of the block. So that's a little bit about me, but I also work a full-time job where I work with planning and science and with the federal government. So that's just a little bit about me.
Thank you. Thank you so much, ladies. I am so excited about this panel because one of the things we don't talk about enough in our community is mental health. And it's something that affects us so much. And as you know, what we do in the coalition, we want to deal with the issues that are affecting our people and not only deal with them, but also create long term solutions. Those of you who are listening, you can go on the Coalition of Churches and Community fan page, click like and share. Go ahead, go on the Coalition of Church and Community fan page and click like and share. All right. The first question we asked today is, what is your definition of mental health? This is open to anyone. What is your definition of mental health?
Well, the definition of mental health deals with how well capable you are able to function in society under what we call stable conditions. Mental health makes a difference as to whether you can function with or without medication on a daily basis. There's a stigma that is connected with mental health for African Americans. And I find that many of us don't seek out health care and treatment and the stability of our mental health because of the fact that we have this stigma on us. Oh, it's something wrong with you. You got mental health issues. Oh, you're depressed. Oh, you have anxiety. Oh, you're dealing with panic. It's something, you schizophrenic, you bipolar. So mental health is something that a lot of people in our African American communities try to shy away from. And we shouldn't.
Thank you. The question is still open. What is your definition of mental health? How do you define it?
I think for me, mental health is looking after your emotional, your psychological, physiological health overall, right? And it's a balance between all aspects of your lives, right? And so we have to be able to bounce back from situations in a proper manner. And so if we're having, certain types of situations that are triggering us in ways, how can we bounce back in a healthy way and be resilient from those situations? And so when you're thinking about your emotional health, you want to make sure that you are in a state of being able to cope with what you have going on at the moment, and then moving forward and having those tools to function in that space moving forward. So you won't always have to be in a state of a chronic stress or being in a state of PTSD, because a lot of us have that and don't realize that we have that.
And you said something that was very important. You said that a constant state of stress. Why is it important for us to spread mental health awareness? Why is it important for us to share with people the need of mental health, the need of understanding, the need of professional help, the need of support, the need this very, very, very critical need? Why is it important?
It's important because as human beings, as social beings, we need those types of tools to function, right? So we need social support. We need someone that is unbiased to our situation so we can have someone to talk to. Balling up those emotions every time you go through a situation or dealing with a stressful situation, and you don't have an outlet for that, a safe space as we call it. If you don't have that safe space and you keep building, you reach a tipping point where you just explode, right? It's like a volcano. Like it keep building up, the pressure keeps building up until you erode. And so when is that erosion point? And so you want to make sure that you have these tools like social support. A lot of people, especially during COVID, we have to realize that we're in a unique state right now. COVID-19 has put a lot of mental stressors on us as far as, being social, economic stressors, emotional stressors, because now we're in a state of being with, people, or being isolated from your work, from your coworkers, or from your family. And so how are we bouncing back? How are we being resilient during this time? And it's not just during this time, but before this. But this is compacted on to our mental health as well. And so we have to have those resilient tools to bounce back.
You said something that was important, that in this COVID-19 moment, some people are stressed and dealing with issues that they don't even know they're dealing with.
Correct.
And you know why I think that he's freezing a little bit, but I think that the reason why people don't know that they're dealing with certain things is because of this self-medication. Maslow's hierarchy of needs talks about the 5 areas that human beings need, that that self-care, that self-management, and there's self-actualization, there's esteem needs, there's belongingness and love needs, there's safety needs, and there's psychological needs. So when people try to take their own mental health into their own hands and begin to smoke cannabis, not understanding the side effects of it, albeit some cannabis use helps some people when it's given to them by the doctors medicinally, absolutely. But then some of us are taking it, buying it, and it's too much. They're using too much. Then when they become psychotic, meaning seeing shadows, hearing voices, then they're running, trying to figure out how to get some help, when from the beginning, we should do it the proper way, which is through the doctor.
I wish we would have played Grandmaster Flash. Don't push me because I'm close to the edge. I'm trying not to lose my head. It's a jungle sometimes, make you want to wonder how I keep from going under.
Yeah.
And just to piggyback off of Miss Lattimore, is that you can't pour from an empty cup, right? In order for you to be replentiful, you have to pour into yourself. And I think in our community, when we talk about self-care and self-awareness and self-reflection, a lot of people attach being selfish with those acts, but you have to be able to pour into yourself. You have to be doing things that make you feel good. And I'm talking about healthy habits, right?
Yeah.
Working out, eating healthy, spending time with your family, reading, doing those things that make you feel good in a healthy way. Not those addictive behaviors, but we're talking about healthy behaviors where you're pouring into yourself so you can be plentiful, so you can pour into others.
And it's nothing wrong with taking care of yourself, is what you're saying.
Exactly.
Well.
Can you guys hear me?
Yes.
Oh, okay. Like Miss Lattimore said, she definitely hit on one of my biggest things that I love to do, and that's self-care. And oftentimes people look at self-care as selfish, right? They look like, why would I do this for myself? Especially moms and that are raising the children in the hustle and bustle of life. They often look at taking care of themselves as, they don't have the opportunity and time, so they get overwhelmed with things. And, and self-care looks differently for everybody. And it doesn't have to cost a thing. It doesn't have to cost a thing. It could be very free. It could be just going out and sit in your backyard with a cup of tea, with a cup of joe. It doesn't have to be this long or this hard thing that people often think that it is, or this selfish thing of having to go spend money or anything like that. It could just be just having some quiet time and just sitting down somewhere, so a nice warm bath. So it doesn't have to be like that,
And I think that's another thing that people in our community, we feel like in order to take care of ourselves, we have to spend money, right? And so just some free tidbits. I like listening to meditation music in the car. Like I literally listen to meditation in the car. And when people get in my car, they're like, wait a minute, what are you doing? I was like, this calms me as I drive. It's free, completely free, right?
Free.
And when I come home, you know, just doing absolutely nothing with the TV off, right? TV off, that gives me, that rejuvenates me. Going for a walk, you know, nature is a beautiful thing, and it regenerizes me. And so it's like I really love just doing the basic things in life, the simple things in life, right? Are free, right?
They're
the simple
free.
things.
They're free.
And I agree, because as a clinician, when you're working in an agency all day long, all week long, dealing with people, if I could speak from a spiritual perspective, some feel that it's, you know, it's a moral issue with mental health, and some people feel that it's a disease, you know, and so however you take it, we as clinicians are in that environment all day long, every day of the week, and we need to practice self-care and self-management. And like you said, a lot of that doesn't cost anything, but if you can't afford, you know, I'm doing a full body massage next week for my birthday. I had to throw that in.
Enjoy.
I'm going to enjoy a body wrap and body massage for myself. You know, pedicures, manicures, men and women can do these pedicures and manicures. As people, we've got to take care of ourselves. You know, there are some schools that you can go to. They're always looking for people to experiment on, young teenage students who would love to do a body massage on you for them to get a grade. So there are different ways, like Miss Candace said and Miss Sherry said.
So I can't help anyone else until I'm first able to help myself.
Absolutely.
And so I can't give medicine as a doctor until I first have been able to be healed myself. So those are very, very powerful statements that we shared on the necessity of it. So from your point,
Looks like he froze up again.
He'll come back in.
of use in your land. All right, I can hear you all. So what's the necessity of therapy, counseling, and professional care in the African American community? The necessity of
It's
Well, now more than ever. I think that especially since we've been really making a point to talk about our mental health and our mental health in the last, maybe 6 or 7 years, this has been like a really big conversation to have. So the question is why not now, right? Like, why not now? You know, let's normalize talking about taking care of our mental health just as much as we talk about going to our physical, taking care of our physical, you know, body and things like that, going to your primary care. Let's have those real conversations with people. So why not now?
You know what, Sherry? You know, I'm glad you hit on this, because last year, every August is pretty much health month, right? Health prevention month. And I actually was doing a mini survey when I was teaching a class, and 8 of the pillars that I teach for, you know, for self-care and, you know, mental health and resiliency. And so a lot of people in the room haven't been to the doctor 5+ years. Like, they have not been to any type of doctor within the last 5 years. And so, you know, I'm a big component advocate for going to the doctor. You know, we have a history of not going to the doctor because of medical biases and things of that nature, social determinants of health, right? But if you don't know what's going on with yourself, you have to be able to understand what's going on with your body. And so if you don't understand what's going on internally, you can't expect to know what's going on with you externally, right? And so you want to know what's going on with you, because sometimes folks in our community show up at the doctor and they're in, stage 4 cancer, right? Because they haven't been going to the doctor getting those checkups. And so you got to make sure that you're going to the doctor, being open and honest with your doctor, but also getting a doctor that is culturally competent of hearing you out, having a comprehensive plan with you so you guys can make a plan together when it comes to your mental health, your physical health, and all those other things that come along with, making sure that you're healthy. Because everything else, because this is health psychology, if something is going wrong with your body, 9 times out of 10 is something going on with your brain, with your mental state. So if you're sick, it's something, it affects your mental state as well. So we got to make sure that we understand that we have to have those behaviors normalize going to the doctor, right? We want to normalize that.
Yeah.
I give a scenario often about healing the fracture in our community, and healing the fracture is more than you fall, you break your ankle, right? The doctor says you need 6 weeks, 8 weeks, 2 months, whatever, to heal that. But you decide to get up in 2 weeks. I'm gonna get up and I'm gonna just keep on walking. I'm fine. It's a little bit of pain, but I'm gonna just keep on going, instead of dealing with some of the things that we've dealt with in our life, like traumas, and dealing with maybe a divorce, or maybe dealing with abusive relationship, or dealing with maybe parents who were not so nice to us, being in the foster care system and being abandoned by your families, and all kinds of things like that. So instead of dealing with that, what do? You put a Band-Aid on it. You just keep on moving. So you've never healed the fracture, but you just keep on moving. So you've got to sit down somewhere and heal the fracture and deal with your physical and your mental so that you can continue to move forward, because it's important to bring the best of you, not what's left of you. So that's. Yeah. Did he freeze up on us again?
Well, let me say this too. 16% from statistics, 16%, which is 4.8 million of Blacks and African-American people reported having mental illness. And 22.4% of those, which is 1.1 million people, reported a serious mental illness over the past year. And we can't even talk about the serious mental illness rise among all ages of Black and African American people between 2008 and 2018. But suicide is really another one that's on the rise as well. Suicidal thoughts, plans, attempts are all rising among Black and African American young adults. I work like where I work. One day the client can come in there to get the methadone shot, and the next time we hear that person overdosed. And that has happened to some of the counselors that I supervise. And as a supervisor, I have to be available for them to be able to come and talk about that trauma right at work, So all of that, as we talk about it, all of it ties together. That is a very important piece to it. Self-care.
So one of the things we were sharing about healthcare, and sometimes people don't really realize that they're dealing with trauma. And oftentimes we think that trauma is something physical, or trauma is something that happens if you are in the military and you have some psychological effects of what happened to you in service. But can we talk about trauma for a moment, and how many people deal with trauma? It could be an abusive relationship. It can be trauma from childhood. It could be psychological trauma. Their mother could have left them as a child on a doorstep. Trauma. It could be trauma because they've been hurt. Trauma because of something an old boyfriend or girlfriend did to them when they were 14 years old, and now they're 34, they're 44, they're 54, they're grown, but they still have the thinking patterns of someone who's a teenager because of that trauma. And so, can we speak to trauma and how trauma affects us every day?
So I will say that I'm glad you touched on this, because I'm a veteran. I'm Navy retired. And when I was doing my research in these last few years, I'm realizing that many people, even in the military, that have dealt with trauma from the military, we're realizing that that trauma did not start in the military. It started when they were a child. They had ACEs, right? They had adverse childhood effects, right? Experience. And so those things stem, and then they go off to the military, and then they experience more traumatic experiences such as military sexual trauma, combat exposure, injury, all those types of things. And so we have to sometimes the trauma that we experience comes in many different forms. And so all of us, didn't grow up in the same neighborhoods. Even in Washington, D.C., that I have seen, we have a lot of people that live in Ward 7 and Ward 8 of Washington, D.C. that have trauma due to gun violence. And so it's like the neighborhood that you grow up in, sometimes the neighborhood is so traumatic that you have those traumatic episodes where it does affect the way you develop relationships, friendships, or any type of ships that I say with people around you, because you are so guarded in how you expose yourself, right? The trauma does not give you that vulnerability to show up in your best self.
Yes.
And
Trauma. And a lot of times I realize, even as a pastor, from a pastoral point of view, from my perspective, that you have people in your congregation who go to church and they go to worship, but they still dealing with trauma. And some people, especially in the Black African American tradition, we use religion and faith as our counseling center. Church is therapeutic. So people go to church. That's why you see people jumping and rolling around, flipping up off the pews, and shouting their weaves off, the suit off. When some of these people should be in somebody's chair, be at some mental institution, getting some talking to, because the reality is, and this is from pastoral perspective, is that although we get temporary relief, but we don't have permanent change. And so we are commingling our spiritual need with our mental need. And so some of us, we shout it out when we should go and think it out, talk it out. And now I do believe in the power of prayer. I know y'all not preachers, but I am, so I'm going to talk about
I
that.
am.
I do believe in the power of preacher, power of prayer, but there's some things that you need to go to a counselor for. If you're dealing with trauma of being raped as a child, the Lord can deliver you, and He can touch your body, soul, and mind. But you also need to talk some things out, like,
Yeah, that's so true what he's saying about that.
how am I relating to of rejection? How do I deal with that? Can we talk about that for a moment? That kind of perspective.
Oh,
I would love to real fast, because I'm glad you're speaking, Pastor. I would love for the bishops, the pastors, the apostles, the evangelists, the ministers, church leaders who lead God's people to come and see me. I have pretty much tried to, Pastor Floyd, run a campaign every chance I've gotten, if you look at my Facebook page, to get those who are in leadership to come and get the self-care for themselves, because I'm hearing about how so many leaders are committing suicide as well. Who does the pastor talk to? Who does the bishop talk to? Who does the apostle talk to? They talk to the people in their congregation, their adjutants, the person that's the closest to them. They're going to go talk to them quicker than they'll come talk to me. And that's when it becomes detrimental, because the pastor has to trust somebody.
I think you have that wrong. I think you have that.
You froze up on that one.
I want to hear how I could need to get that.
I agree with you though, Miss Lattimore, because they have to also have an outlet as well.
Yeah, they
Yeah.
can't talk to just their own people in the congregation that they're leading to God. Those are the people that need to hear from God through them. And if they're not on the right page with it, or they're needing medication, who do they go to? Who do they turn
Right.
to?
And I think that's another we always look at the past, like the leader, the Christian leadership as, the head honcho, right? But who are they, looking to get their mental health, in
That's
check,
right.
right? And so
Exactly.
sometimes some Christian leaders, they also have the stigma of not going to see a therapist because
Mhm.
they believe that being that they
Yes.
are they're a leader, they can, they can pray it out, but
Mhm.
we also have to remember that spiritual, being spiritual is also part of the 8 pillars of being healthy. So it's not just, spiritual and then you
Mhm.
skip all the emotional and psychological. You can't do that because that's part of the 8 pillars, right? And so that's just like saying, I'm a bad, I don't like my emotional health, but I'm a pray, but that's
Yeah.
spiritual and emotional. So it's two different things that we
I
have to
agree.
deal with. So it's like we take one linear thing and we
Mhm.
try to apply it to the whole to all the equations, right? And so
Mhm.
that's not how math works, right? So we have a formula for this particular situation, and we have a formula for this, right? And sometimes you can use those formulas together to formulate a plan, but you just can't use a hammer for everything, right? You can't
Right.
use that hammer. You have a tool belt for a reason. And so you
Mhm.
gotta make sure that you're using all of your tool belt efficiently.
That's right.
Well, I
And
was saying you were wrong and right. I was saying you're wrong and right. When you said the pastor goes to the armor bearer, that's wrong. Or the deacon, that's wrong because pastors have the push of image of, if I'm going through this, and a lot of people are not transparent because if I got an issue, then some people might use that issue against me, or against the person. So I think that it's a thing of leading while bleeding. And most people lead while they bleed when you cannot help other people until you're able to help yourself.
Absolutely.
And that's in
exactly.
any position, whether you're a politician, whether you're a lawyer, whether you're a doctor, and it
Whether
becomes a
you're a
question of,
pastor.
yeah,
Yeah.
pastors, it comes the question of caring for the caregiver. Who cares for the person who cares for everybody else?
Mhm.
Right.
You have some people trying to save the world and can't save themselves.
Mhm.
Absolutely.
Okay.
That's true.
So I was
Absolutely.
agreeing with you. I was just saying that last part. I was agreeing with you. Don't worry. And so when you look at the idea of trauma and how that affects us, um, how do we help people see the need of mental health, but also the effects of not receiving help in the interim? How do we become that in between, that go between, the people who, you have some people say, well, I don't need it, I'm fine, I'm good. How do we be that go between to let them know that, listen, you need to some help, you need some support, you need that? How do you do that in a way that people will receive it?
You know, uh, just by the words that you use, we have to be careful, especially people that have mental issues. Instead of saying you need, maybe say that you could benefit,
Right.
um, because you could benefit with going to talk with someone. You could benefit from seeing a therapist instead of you need. Because when you say like you need to people, that's like, oh, you don't know what you're doing, or you need this, you need that, and we don't want to address people like that, especially when they're already dealing with
Well, thank you for that note.
situation. Yeah.
Appreciate it.
And then also you want to make sure that you are there. First of all, you have to gain their trust. That's number
Mhm.
one,
Yeah.
right? When you are trying to help someone through a difficult situation, you have to be able for that person to trust you and have options open for them, right? Because if they feel like they only have one option like the need, like saying you need, the wording, the literacy behind that. When someone is saying that, but instead of just talking to them, being a sounding board, but also listening, actively listening to them, and giving them resources and letting them know, hey, I'm here for you. If you have any questions, you know, if you're going through something, give me a call. You have to be this. You have to produce that what we call a not a wall, but a group around you. We have to protect. We got to start protecting our own. And when you see a brother or a sister going through something, you pull them along too. You bring them along in for the ride, and you let them know that, hey, you know, I'm here. And some people don't have that. Some people don't have a social support system. They don't have family members that are there. They don't have close friends that are there. They have to lean on complete strangers to get what they need, and what they need for them to go through that situation. And so we always have to be able to pull others along, and not in a genuine way, not in a emotive type of way, but in a genuine way. We have to pull each other along and make sure that, you know, when you fall, I'll catch you. Not in an enabling way, but in a way that they know that you are there and you will be their sounding board and their social support.
I agree with you. I had a client call me today, even crying pretty much. And I work from home, thank God. Even though I'm over working in the clinic, I work from home at this time because of COVID. But the young lady called crying. And I was like, well, where have you been though? You know, it's like, you abandoned me. I'm your therapist and you just stopped, you know. And then when I hear from you again, you know, you're crying and you know, all in an emergency state. And I'm like, people have got to take us seriously too. If you start with a provider, I'm a provider. Although, you know, I take insurance, I take cash, I take it all, but don't let that be your reason why you just stopped, you know. And sometimes people feel they can't afford it. They're embarrassed, you know, they're frustrated because of their finances. And then this COVID thing hasn't helped anybody. So I just agree with you. I agree 100%. You know, people have got to take therapy seriously. Take us who are in the profession, whether you're a life coach, right, Miss Sherry, or whether you're actually, you know, someone, a friend in the community, or a licensed professional such as myself, you know, or, you know, whatever your title is, like what Miss Candace was saying. All of us play a part. Yeah, I'm licensed. Yeah, I got the papers, but the motivator plays a part. Miss Candace plays her part. You don't have your credential. I don't want to call you Dr. Candace. I'm giving her
she's going to be Dr. real soon.
Right. I'm giving her Dr. Candace.
She has a
I don't want to be out of order.
Real soon.
Yeah. So yeah, I have the alphabet soup behind my name.
I know you do. It's okay. I got you.
But you know what? I'm glad you said that, because yesterday, you know, the big word these days are diversity, equity, and inclusion, right? And so this falls into mental health. And so the access that some of our community do not have when it comes to mental health. And we have to be able to get those resources out to those that don't have the access. We don't have health equality, equity in our community when it comes to just basic health care, right? So when we start talking about a specialty like behavioral health, it's access, right? And so the access plays into the stigma. The access plays in the economics, because if you're in Ward 7 or Ward 8 and your doctor's office, your therapist is in Ward 3, how are you going to get there, right? And so you don't have a car, you know, you may not can afford it. And so it's like we have to sometimes bring the resources to your doorstep. And so telehealth is very great, but we also the health equity of it all. And so that's another thing that the public don't really talk about. You guys probably start hearing health equity and social determinants of health and health disparities, you know, very heavily during COVID. But we've been talking about these things for many, for decades, especially social determinants of health. And behavioral health falls under that. And we have to be able to explain, put out the health literacy for that, because a lot of people don't understand what mental health is about or behavioral health, because behavioral health is a component of mental health, but it has many other layers in that when it comes to behavioral health. And so we have to make sure that we are doing our parts as leaders in all components, because we're leaders in our community in some form or fashion. We have to be able to put information out there, great information, factual information, not misinformation, because there's so much misinformation out there about mental health. We have to be able to put the correct information out there and be consistent with it.
Well,
And refer them to me.
You hit on something that was very important about resource in the community. Next month, I want to bring you back on, Miss Candace, and all of you back on to next month. We're talking about the Black health pandemic, and we're going to have doctors on. We're going to talk about everything from birth to high blood pressure, diabetes, community. Because one of the things we're doing with the Coalition of Church and Community is we're not just locally. Most of you all are the D.C., Maryland, Virginia area. But we have people part of our coalition in North Carolina, South Carolina, New York, Delaware, Louisiana, throughout the entire East Coast, and while we're building in the Midwest and other areas. So when we do these events, people are not just looking at it here, but they're looking at it everywhere. And we have directors in other states. And so next month we're going to have a large forum on the Black health pandemic. We're leading up to that. And I think this is something you shared about health equity, and also where we are as a community. What about the funding, the resources? We need better funding. We need resources. And how do you push? Can you just talk about how do you push for better resources for mental health, behavioral health?
Well, let me say this. Let me say before we actually do have resources. It's with Medicaid, and we use Medicaid as a major resource. And Medicaid is run by the state or the city, and they'll help the client. And they even have transportation. If the client will turn over on the opposite side of their medical cards that they get if they have Medicaid, there's transportation at the bottom of that. A lot of the clients don't even know that. The patients don't even know that that's available. A lot of my clients didn't know that they could get transportation to the dentist, to the healthcare provider, wherever, because they're not educated, like you stated, on what the benefits are that are accessible to them. Even myself, I have Narcan here. If you all know anything about Narcan, Narcan will help a person who's overdosing. This is my way of giving back. I keep it with me. If you run into a person that is unconscious on the street and you put 3 shots up one nose, you know about this, Candace, and 3 shots up the other side, I don't know, this will bring that person out of that overdosing state. If you use Narcan, it's amazing. It's a naloxone. There's Suboxone, there's naloxone, and what we use is methadone at our clinic. But this right here, this little box right here, okay, it's free.
So can anybody can get this?
You can see me. I can put it in your hand. Bam, there you go. You got it. Keep it. And I don't keep it in the car. You keep it in your purse, because if you keep it in the car, it'll get hot. Summertime, you want to keep it in a cool place, because if you're down on 2nd and D Street or around the areas where those people you're feeding the homeless, your church maybe is going to give away clothes or give away food, you want to be ready, because that's what you're going to run into. People that are sick and overdosing and on the verge of death.
Well, I'm glad to hear that, because I didn't know that was something that just everybody, somebody like me could have access to. So I definitely need to follow up with you, because I know someone who goes out to the 2nd and D area. She feeds the homeless every Saturday. And, this might be a good resource for her to have.
You can come by my agency. It's 1390 Good Hope Road.
I know exactly where you are.
1390 Good Hope Road, and tell them you want to find out how you can get some of the Narcan spray, the nasal spray, and they will get the nurse practitioner. We got a box.
Oh, okay.
We got a box, and they trained us on how to use this.
Mm-hmm.
We had to go through a little training in-house, and so I know how to use it. It's just 3 shots of
maybe you should train.
Yeah, well, I'm doing it right, and it's on the box. It's the instructions on the box. Yeah. So it comes with instructions, everything.
Okay.
All right. Trent.
I wanted to share also that by me working at within the federal government, I can't say what agency, but by me working within the federal government, there's a huge gap between government and community. There's a huge gap, and one of the ways that I was talking to them recently about bridging this gap was on the community level. That's the only way that we're going to start getting these resources out there, and be very intentional with it, just like they're very intentional on allowing bus stops to have cigarette advertisements, and just like they'll allow metros to have these expensive stores that come in and buy ads. They need to be very intentional on the way that they're reaching the community and where the community is, and finding out where they are, and reaching out to the municipalities individually, because I'm in the county. I'm right here in Capitol Heights. So of course, I'm like right across the line, right? Mm-hmm. But yeah, we need to be reaching out to these municipalities as well, because they have direct contact with the community. Right. They know who lives in their community. The police officers know where the drug houses are. They know where, certain things are happening and what's going on. They need to have direct contact with the community. And that's the gap that we're experiencing when it comes to getting some of these resources out there, because even though they're there, they're not really reaching the people. People don't trust government. Right. But they will trust, like you were saying earlier, about having somebody that they can trust. Right. They'll trust me. Right. They'll trust me if I come to them and I'm talking to them at a municipal meeting, or we're doing our community event. They'll trust it coming from us. They're not going to trust it coming from government.
Well, I will say that, and I addressed this in a meeting in DC, a health equity meeting in DC, and I said, we're talking a good game when it comes to the resources that are available, but I'm like, how are you getting those resources out to underserved communities? I was like, what are we doing? I was like, we have abundance of resources, but I was like, it's like a straw. I was like, all the resources are up here, but the straw that's going out to the community is not being it's not being accessible. And that's where the social determinants of health comes in, the health disparities, because we already know when it came to COVID, we already know where the vaccines were popping up at, right? They weren't popping up in Ward 8, Ward 7, and in PG County just out the blue, right? We had other counties and other, wards that were getting vaccinations first. And so it's like, we know a disparity is there. And so also we have to be individually, we have to participate and advocate for ourselves when it comes to our own, healthcare, our health participation, our planning, because guess what? The person that got your back the most is yourself. And so if you're not advocating for yourself when it comes to mental health, your health care, nobody else can advocate for you better than yourself.
Let me just say this while you're on that, when you're talking about DC in particular, that the same things, the same issues are prevalent in most metropolitan areas where you see minority based areas get lower funding, less resources, less access to health care. It's just throughout, and not only through health, but economics and so many different ways, education. So it's important for us to advocate and to be able to not only be a voice, but we need to have tangible, strategic means to get these things changed, tangible, strategic means wherein the people can mobilize to make a difference. That's what we really, that's the aim right here. This is not just to have a nice conversation, because when this is over, the CCC is meeting on how do we really push this in our churches? How do we push this amongst our nonprofits? How do we push this amongst our business owners? How do we push this amongst our community? And it's important for us to come together and to be able to build that bridge between the community, build that bridge between the people who make public policy, and speak truth to power to get things done. And one of the things Francis Bacon said, knowledge is power.
Yes.
Um,
Yes.
you have knowing your knowledge is powerful. It's a powerful thing. It's a powerful thing to know that there are resources available. Now somebody's going to be searching. Okay, what are the resources I have available? To know
Right.
that there are programs in my community. There's access to this. And even with what Miss Lattimore said about the spray, some people didn't know that. And so this is all powerful information. But after this session is over, it would be injustice for those of you who are listening not to seek mental health or self-care, not to support an entity that's providing it, and also not to push resources, information, or the access thereof in the community. It'll be indictment upon us as community leaders, churches, nonprofits, and business persons who are gathered together to not push those things.
And I want to say that every Sunday night, because I'm a cancer survivor, I'm a breast cancer survivor as well, for those that even may be dealing with that as a trauma, because cancer within itself or any type of diseases like that causes people to be traumatized. Every Sunday night this month and in July, we'll be praying for people that are dealing with trauma through cancer and kidney failure. So all of that is a part of me giving back to the community through Facebook. I'm on Facebook. We do that one time a week where we're just touching and agreeing with you and believing God with you. Yes, you can come to me and get counseling, but who is the wonderful counselor? The mighty God,
All
the
right.
Prince of Peace. His name is Jesus, and we've got to continue to point people to Christ.
My Lord.
Pointing you to the box of Narcan. How about I point you to Jesus Christ? How about that?
All right. She's about to preach a sermon out here.
Go.
I'm an
ready to give us-
evangelist. I am
All right.
evangelist.
All right. She's an evangelist and a counselor. But we have a wonderful counselor. So listen, we're going to have you all give your closing thoughts and remarks, and then I'm going to share with you a little bit of information, and then we'll move forward. If you would share your closing remarks, we're going to start with Lattimore, then Miss Sherry Cook, then also Miss Candace Willott. Soon to be doctor, though. She's going to be doctor.
Okay. Well, I just want to say, just like I did say before, is there a balm in Gilead? The question was asked, is there a balm in Gilead? Meaning, is there a healer? Yes, there is a healer. Yes, there is a balm in Gilead. And I am a disciple. And my name is Evangelist Anita Lattimore. And even though I may, like I stated before, have all the education and have all of the knowledge and all this and all that, I give to you Jesus Christ, because he is the healer. He is the one. And if you turn to him, he will heal you. I can be reached by my website, which is iamlistening.biz. iamlistening.biz. Please get in contact with me through my website. You can send me an email. You can call me. All of my information is there on my website. And I'm giving a shout out to my church, Course of Praise Christian Church, and my pastor, Lamar McIntyre, who is on tonight watching this broadcast. God bless you all. Thank you so much.
All right. So you want me to go ahead and go, Pastor LK? I think he's frozen. So
Thank you. Yes.
okay. So I want to leave you all with this. Is like we were saying about mental health. Be intentional with your mental health. Be intentional with your mental health, just like you are about making sure that you have the latest and the greatest of everything. Okay. Be intentional with taking care of your mind. Be proactive instead of reactive. That means take care of before something happens and not just be reactive to the situation, because you do have control over what you allow to be in your immediate circle and what you're feeding yourself and those things and outside sources and outside things that are telling you all of what you should do. Start listening to yourself. Trust yourself. Take care of yourself. And so, listen, I don't have any degrees behind my name, but I do have a whole lot of motivation. I do have a whole lot of passion and encouragement for you to live this life as best as you can, to be the best you possible. So if you want to get in touch with me, you can always reach out to me. I'm Sherry Cook on Facebook. I'm keomworks@gmail.com. That's KEOM works @gmail.com. You can always email me. I'm here to talk, chat, and then guess what? If you need a little bit more, I'm gonna point you in Miss Candace and Miss Lattimore's direction. Okay. I love you to life. Take care of yourself. Thank you for having me, Pastor Floyd.
All right. Well, thank you for having me on. And I'm very passionate about health. I can't tell people enough. I'm passionate about health. I research it. I live it. I help others. I'm in the community with my boots on. I'm getting the things done. And what makes me happy is that I'm getting somebody else healthy, right? That's my main goal, is to have all of us healthy and happy and living an abundant life. And so if you have any doubt about what you need, you can always use your phone, right? Google is your friend. It's right at your fingertips. If you don't know something, if something sounds weird to you, make sure you get on it. You can get on your phone and Google what you need. But if you don't, you can contact me at any time at Bountiful Health Wellness, at bountifulhealth.org. So you can contact me at any time on the website, and my email is bountifulhealthwellness@outlook.com. And I'm available anytime that you want to speak. Just send me an email. If you need anything, if you need a resource, if you need any type of mindset, behavior change, just give me a call or give me an email, and I'll shoot you an email back. But I will respond rapidly. So I want you guys to get healthy. When you change your mindset, you change your perspective.
Thank you, everyone. So, panelists, you did amazing. Thank you for joining Coalition of Churches and Community USA. We're going to have another panel on health. We're also establishing a health community.
You're breaking up really bad, Pastor.
Okay, can you hear me now?
Yes, go ahead.
All right, we would like to check out our website, cccusa2020.org. Come on and be a member of the Coalition of Churches and Community. Those of you listening, we know that we have a lot of work to do as advocates for equality, economics, and education. You all have a great day. Continue to spread mental health awareness.